right, good morning, everybody. My name is Representative Jon Richards, and so glad all of you were able to join us here this morning. In addition to the people speaking today, we have several members of the State Assembly who are joining us to talk about strengthening BadgerCare, and I just wanted to introduce them before we start. Representative Todd Onstad, Deb Colsty, Mandela Barnes, Eric Gingrich, Dana Wachs, Daniel Reamer, Therese Berceau, Brett Halsey, Josh Zepnick, here. And Melissa Sargent, and Fred Clark. So I hope I got everybody. If I missed anybody, don't take offense. And we have Senator Erpenbach here. So,
by the way.
Yeah. The co-sponsor of the bill will be talking at length. But thank you all for joining us here to introduce the Strengthen BadgerCare Act. All of the ads, phone calls, and door knocking are done. And hallelujah, the election is over. Now it's time to make good decisions for our state. One of the best things we could do today is to help those middle-class families struggling with how to pay their health care bills. The federal government now will pay Wisconsin 100% of the cost of expanding BadgerCare over the next 3 years. Then for 6 years after that, it will pick up 90% of those costs in funds that are already set aside. So with federal dollars paying most of the cost, we could cover an additional 175,000 people. And the nonpartisan Legislative Fiscal Bureau estimates that we could actually save the state money in the next budget by doing it. And we have a memo from the Fiscal Bureau available to all of you after this press conference. This morning, we call on Governor Walker to use these federal funds to expand BadgerCare. We also call on legislators from both parties to pass the Strengthen BadgerCare Act, so that no matter what the governor decides, we're guaranteed more coverage for people who need it. The extra federal funds are made available through Obamacare. But strengthening BadgerCare isn't about loving or hating Obamacare. It's about knowing a good deal when you see one. And this is a good deal. We can insure up to 175,000 Wisconsinites by closing a gap in BadgerCare. We can save the state an estimated $65 million in 2014 and 2016. We can bring an additional $4.5 billion with a B dollars of additional federal health care funds to Wisconsin through 2020. And we could create an additional 10,000 jobs. Finally, all 150,000 people now on a waiting list waiting to get coverage would be able to stop waiting and get insurance. Taking this deal is the right thing to do because access to health care is a key to middle-class security. And you'll hear some stories about that today. But we all know that having basic insurance can mean the difference between keeping your diabetes under control or having it spin out of control. Maybe requiring a massively expensive operation that could have been avoided if you had access to decent care and medication. The Strengthen BadgerCare Act requires the state to take the necessary steps to qualify for the highest available federal match for BadgerCare to cover childless adults. If we need to slightly adjust benefits or co-payments to qualify for 100% funding, this bill requires the state to make that adjustment. The bill prevents the state from changing eligibility standards that would block us from qualifying for the money now available. All across Wisconsin, the middle class are struggling with how to pay doctor and hospital bills. It happens to Democrats, it happens to Republicans. We call on Governor to join the other Republican governors from around the country who've seen the wisdom of taking this good deal and help the Wisconsin families who are facing this challenge. And we call on the legislature to do the right thing and the smart thing and pass the Strengthen BadgerCare Act. And now I'm going to turn it over to Representative Sandy Pasch.
Thank you. Thank you, Representative Richards, and I want to thank Representative Richards and Senator Erpenbach for their hard work on this important legislation. You know, it wasn't that long ago that Wisconsin was considered a leader in healthcare quality and access across the nation. But over the last 2 years, under the Republican leadership, this reputation has taken a huge hit during one of the most divisive, extreme, and partisan agendas our state has ever experienced. Time and again, the governor and his legislative allies have put their own ideological agenda before our everyday citizens. In the process, the health of our communities was undermined as people were kicked off their health care and put on never-ending wait lists for coverage, for vital coverage. Affordable access to quality health care should be a right, not a luxury for those who have the greatest ability to afford it. Protecting and promoting this access is not only the right thing to do, but it's the smart thing to do. In turn, we're introducing the Strengthen BadgerCare Act in order to help out our everyday citizens on a path toward economic stability by strengthening health coverage for uninsured individuals, stimulating our workforce, and reducing the tax burden on Wisconsin individuals and small businesses. Wisconsin's middle to low income individuals were hit the hardest this last legislative session, as Republicans cut vital programs across the board, while at the same time giving millions in tax cuts to special interests and huge corporations. We owe it to the hardworking families that we represent to ensure that one accident or one medical issue won't overturn their lives because they don't have quality health coverage. No one should have to put off going to the doctor when they're sick because they can't afford the medical bills. The Strengthen BadgerCare Act is a smart, common sense step towards rebuilding Wisconsin's middle class and promoting economic stability for our everyday families. And I hope it will be supported by my colleagues on both sides of the aisle of this session. Thank you.
Thank you. Now I'd like to call up Representative Chris Taylor, who is a member of the Assembly Health Committee.
Thank you, and thank you so much to my colleagues for being here today. I think you can see that this issue of access to health care is incredibly important to us. This is about making sure that hardworking Wisconsin families have access to the health care they need to be healthy. And we know we continue to not meet the need out there. There still continues to be about 500,000 Wisconsinites who do not have access to health care. So this piece of legislation and our commitment to keep working to make sure that people have access to affordable, accessible health care is not just the compassionate thing and the ethical thing that we must do. It is the economically responsible thing that we must do. Availing ourselves of these monies will have a particular impact on Wisconsin women. Wisconsin women continue to experience higher rates of being uninsured, particularly childless women. And this impacts younger women and it impacts older women who are not yet eligible for Medicare. These younger women, low-income women without dependent children, typically are in poor health. They face obstacles, many obstacles in accessing care, and they are usually or more typically a member of a racial or ethnic group. Access to Medicaid is shown to improve health outcomes for these women. Low-income older women whose children have grown also have problems accessing health care, and these are a group of women who typically have higher rates of chronic diseases. These women need coverage opportunities before they are eligible for Medicare. But as I said, closing this gap in coverage, and this is really about access to health care, is not just the compassionate moral thing we must do, it's the fiscal responsible thing we must do. It will create 10,000 new jobs. Again, this has a significant impact on Wisconsin women because 80% of Medicaid-supported health sector jobs are held by women. So this increases employment opportunities for Wisconsin women. This will result in $1.3 billion flowing into our state. Wisconsin, unfortunately, continues to be at the bottom of the barrel for accessing federal dollars. This is a way to help us access those monies so we are improving the health outcomes of our citizens and creating the economic opportunities that we all want. So we are calling upon Governor Walker and we're calling upon the legislature to stand up for Wisconsin families, to do the right thing for Wisconsin hardworking families, and to pass this bill and to access these monies that will only improve our state. Thank you.
Thank you. Now I'd like to call up Senator Jon Erpenbach, who has been a champion for health care in the state for more than a decade, really one of the leading voices in the state and the nation on expanding health care to people who need it. And I'm proud to say he's the co-author of the Strengthen BadgerCare Act.
Thank you, John. And it's been a pleasure working with you on this stuff. It's been frustrating at times, not because of who John happens to be personally. It's just been very, very frustrating because if you think about it, a lot of these decisions by lawmakers, by governors, whether someone can or cannot have health care or access to health insurance, is coming from people with health care. We have health care. We have affordable health care. As a matter of fact, we as legislators and Governor Walker and Secretary Hipsch and everybody who's working for the state technically has access to choice, paid for by the taxpayers. Now, we talk about federal money. It's actually our money. It's our money that hardworking men and women all throughout Wisconsin has sent out to Washington, whether directly for Medicaid programs or indirectly. It's our money. And the governor has a track record of turning down our money that we send out to Washington. Whether it's $1 billion in high-speed rail funding that was our transportation money that went out to Washington that could have created thousands of jobs here in Wisconsin, or the money we're talking about today that could create, as Chris said, about 10,000 jobs here in Wisconsin. This is coming from a governor who wants to create jobs, yet when he has an opportunity to do so with our money, he says no. There's 170,000 people right now who could benefit directly and immediately if Scott Walker does the right thing. And that is to say yes to the money we send out to Washington. That's all he needs to do. It's not that the 170,000 people are choosing to go without health insurance or health care. It's not that they don't get sick, because they do. And in some cases, they are the sickest among us. It's not that the hospitals don't pay for this, or doctors don't provide the services that they go to school to do and that they love to do and to take care of people who are sick, but they would like to be paid for it. This could save a couple $100 million at least in charges that hospitals have to write off. And I love hospitals, but somebody's paying for it somewhere. Again, I can't stress this enough. This is our money. And the governor has a very, very conservative agenda here. He's trying to be the most conservative governor, I think, in the history of the country. By saying no, he's being conservative to somebody, but certainly not to somebody who lives here. People who live here need help. These 170,000 people are actually Governor Walker's constituents too. Some may have voted for him. Some may have not. Who knows? That's not the point. The point is there's 170,000 people in Wisconsin right now who need help, and all Governor Walker has to do is say yes. And the indications we're getting so far is he's leaning against it. I don't know why. Again, this coming from a guy who has health care already, who has had health care, taxpayer-funded health care, for a long time. So I urge the governor to do the right thing, accept the money, get the 170,000 people covered, and we can move on from there. Thanks, John.
Thanks.
Hey.
Next, I'd like to call up Representative Dana Wachs from Eau Claire, who has a story to share about how the changes we're calling for in the Strengthen BadgerCare Act could help real people in Wisconsin.
I practiced law in Eau Claire, have for many years, and you really understand and find out the impact that these issues have on people when you're in contact with them and you're representing them. A few years ago, I had an opportunity to meet Bruce and Diane Ewings, and I represented them on something that wasn't directly a part of the story that you're going to hear, but Bruce and Diane were proud farmers near Chippewa Falls, and they demonstrate how all of us really hang by a thread when it comes to economic security with regard to health care. Bruce and Diane farmed for about 30 years, and when their son turned 18, they no longer could qualify for Badger Care. So the family ended up losing Badger Care. And unfortunately, just before they lost Badger Care, Diane was diagnosed as a diabetic. So the family tried and tried to get private health insurance, and they were excluded from it because of a pre-existing condition at the time. It was an exclusion. Well, a short time later, Diane had to have one of her legs amputated due to this diabetes. And this family is an upstanding family. They had $155,000 in medical bills that they needed to pay. So they sold their farm to their 19-year-old son, financed the purchase and sale of the farm so that they could pay their medical bills. They did the right thing. They retained a small house And Bruce's life from that point on was going to be taking care of his wife and fixing that house. A short while after that, Bruce was in a terrible car accident. So both of them ended up living their lives in wheelchairs. We hang by threads. We need to understand and acknowledge that. Thank you.
Finally, an important aspect of this Strengthen BadgerCare Act is the benefits it would bring to Wisconsin's healthcare providers. And it's interesting to note that both the Wisconsin Hospital Association and the Medical Society have come out in favor of the Strengthen BadgerCare Act. And I'd like to call up Dr. Jeff Hebner now to say a few words.
Thank you very much for the opportunity to speak today. My name is Dr. Jeff Hebner. I'm a family doctor here in Madison and National Vice President of the National Physicians Alliance, an organization founded in 2005 to advocate first and foremost for our patients. NPA endorses the Strengthen BadgerCare Act today, and NPA and physicians from around the state respectfully ask Governor Walker and the legislature to strengthen BadgerCare and take advantage of the already set-aside federal funds provided for this by the Affordable Care Act. Improve access to affordable health care for an estimated 200,000 Wisconsinites over the coming decade. We believe efforts to expand BadgerCare will save lives here in Wisconsin. I am proud that leaders in my profession, as it was mentioned, and several other medical and hospital groups from around the state are speaking up on behalf of our uninsured patients. Patients that come from hardworking families and communities who otherwise will not be able to obtain the high-quality, affordable health care that everyone needs and deserves. Doctors and nurses come to this from a simple point of view. Nobody in Wisconsin should die, become disabled, excessively sick, or bankrupt due to a lack of health insurance and not being able to afford their medical and hospital bills. Physicians unfortunately see every day the effects upon our patients who do not have health insurance and regular access to a doctor. For example, uninsured people are more likely to be diagnosed with late-stage cancer and not survive. This is also a matter of common sense. Let's get health coverage to those who need it, instead of inefficiently spending millions of dollars on patients who have to instead go to the emergency room when they could have been seen by a regular doctor in their primary care clinics. We know that people with health coverage are more likely to have regular access to a doctor, get the preventive cancer screenings they need, such as mammograms and colonoscopies, and afford their life and limb-saving medications for diseases that have been mentioned, such as diabetes, asthma, heart disease, and so many others. Otherwise, people end up more sick, in poorer health, and sometimes disabled. I've seen many of these patients in my practice. Just think of someone who has severe knee arthritis or a terrible back pain problem, and they can't get the care they need, and instead of being able to take care of themselves, work, and contribute to their family and society, they end up disabled. These patients also end up in terrible medical debt, as it's been mentioned. Patients, more than anybody else, are keenly aware of how much the healthcare system costs, how much their bills are. I just had a patient yesterday who told me in no way he could have afforded the medicines we prescribed last week for his asthma that cost $185 per month. As I mentioned, strengthening BadgerCare will save lives. The Institute of Medicine estimates that 18,000 people die annually in the United States due to a lack of healthcare coverage. Just last month, a report landed on my desk detailing how a patient with asthma, which is always treatable and never should be fatal in this country, stopped breathing, his heart stopped, needed massive medical resuscitation, all because he had fallen through the cracks, become uninsured, and could no longer afford his expensive medication, asthma inhalers. Just think, our elected leaders now have a chance to save lives here in Wisconsin if they take advantage of this opportunity. As it was also mentioned, Wisconsin was once a leader in providing health care coverage through BadgerCare during the Thompson years. But now we're at risk of falling behind our neighboring states and so many others around the country. Some policy leaders in the state have commented that Wisconsin already has the #1 healthcare system. While this may be true, what good is that system if hundreds of thousands of our neighbors cannot reliably access that system and a regular doctor. Hardworking, low-income families need the security of quality healthcare coverage that they can afford without facing huge medical and hospital bills. Wisconsin has the opportunity to cover more people and save the state money in the process. Physicians thus today ask our governor and legislators to weigh the evidence, do the math, and do the right thing, and not reject funds already set aside to strengthen BadgerCare, thereby improving Wisconsin's health status, both medically and economically, and saving lives in the process. Thank you.
Thank you, Dr. Huebner. So to summarize, we call on Governor Walker to follow the lead of Governor Jan Brewer in Arizona and Governor John Kasich in Ohio, and take this deal and help Wisconsinites. And with that, we'll open up for questions.
What dialogue have you had with the governor's office on this so far with Republican leaders?
Well, I personally talked to the governor last week about it, and have been talking to people on his staff about it for months. And so this has been a long-standing discussion, and there have been several of us who have talked to him directly for quite some time to make sure he knows what's on the table and to urge him to take advantage of it.
Any optimism on your part that he will? It doesn't sound like it from what you guys are saying.
Well, I mean, we're trying to read the tea leaves like everybody else, and ultimately this is going to be part of his budget, but we're hopeful that he'll see the wisdom in taking this deal like other governors have, and that we can move forward. And,
Yeah, there's something I forgot to mention. This kind of drives home the whole idea of trying to be more conservative than the next conservative governor. The money will be spent. The money essentially already has been spent. The money will be allocated. It's not like if we turn this money away, the federal government's going to go, okay, we can cut the budget by the amount that Scott Walker gave back to us. It's going to go to other states, just like the high-speed rail money went to other states. This Medicaid money is going to go to other states. It's going to pay for health care for people in Minnesota. It's going to pay for health care for people in Iowa. It's going to pay for health care for people in Arizona, in Ohio, and the list goes on. So just by saying no, the only thing we get out of this for an absolute guarantee is 170,000 people, Wisconsinites, people who live here, won't get health care. So for the governor to say no, for whatever reason he might come up with, is wrong. There's absolutely no compassion there. But more importantly, if you want to look at it as a dollar and cents type of a thing, the money will go to other states. And I don't know what the governor's going to do. Secretary Hipsch has indicated that perhaps maybe not. We're going to take a pass on the money. I just don't understand it. There shouldn't be one single person in this state, let alone in this country, who has to go without health insurance. When it comes to all sorts of issues that we have as a country and that we have as a state, we are extremely smart people, but for some reason, we're not smart on this issue. We're just not smart. And for the governor to turn this money down is not a smart thing to do.
Question for one of the two Johns.
It's down the hall to the left. Oh, I see, okay.
I don't know how I made it all these years without knowing that. The 10,000 jobs, where did that analysis come from?
That came from a report by Jack Norman, and there will be several, I understand there will be other reports following shortly.
Robert, you're going to have a report from...
Right, and Citizen Action, the Council of Children and Families, Wisconsin Council of Children and Families asked Jack to run those numbers based on national models for multipliers, but there'll be a newer report from the national source coming next week, which may actually be higher.
Mm-hmm. Great, any other questions? Okay, well, thank you very much for your attention. We'll be available afterwards to take any questions you might have for me.
You like our posters?
I love your posters. Very good, good job. Thanks, everybody.
Hi, go ahead. There's also going to be over 3,000 petitions delivered to Governor Walker now. So all the folks here are going to be walking over with the physical petitions. So that's happening. That is the next order of business.